The political environment in the United States is very hot. Senate is confirming President Trump's different cabinet positions. And being a physician, I am most interested in who will be the Secretary of Health and Human Services. Because one man who can be Secretary of Health and Human Services will impact the future generation through his policies, procedures, initiatives, and incentives he will build. In United States, we do have chronic medical problem and chronic disease pandemic. It needs to be fixed and it needs to be fixed now. I will give Robert Kennedy one good thing, which I've never heard being 34 years in the United States and practicing here, that anybody accurately pointed it out that it is not other diseases, it is chronic medical diseases is the reason we have a pandemic. We could differ what he says, what is his rhetoric, and why he's changing now, and where does he stand. In this podcast, you will learn what are the crisis is, how acute this crisis is, and how we will be able to fix it. What are the systemic and individual changes needs to be made. At the end of this talk, you will be more informed to make opinion whether he should be confirmed by the Senate regarding being Secretary of Health and Human Services. During his debate, before he was nominated, while he was running for president and then later on leaving the race, and then during last couple of months, these are the few agenda items which I will go through. He had been very critical of NHF funding and chronic diseases, his mission, and also his perspective, what he used to hold, what he has done in the past, and where do we stand, and his current rhetoric that he will stick to science and he will not compromise individual liberty and will create environment for individual responsibility, and he will hold big pharma, big food, and the marketing agencies so that we are not marketed with pseudoscience, wrong science, and our behavior is not hijacked. In the United States, we spend $3.2 trillion every year on chronic health care, and we are losing 3.8 Americans every day. Out of that, 21% of Americans die of heart disease, which is purely preventable. The experts estimate that 80% of all healthcare diseases are lifestyle. Cancer affects or lead to 18.6% of cancer-related deaths. We have estimated that about 40% of all cancers are due to preventable diseases. Your genes may be the architect, but you need to write and build a building on those genes for them to manifest. Major problem in United States is wrong incentives, starting from policy to procedures, healthcare delivery models, and lack of individual credibility. We must change and understand the elephant in the room. There are 10 common causes of chronic medical problems which we have: heart disease, cancer, lung disease, stroke, Alzheimer, diabetes, chronic kidney disease, influenza and pneumonia, suicide, and chronic liver disease. Let's understand what Robert Kennedy is trying to propose. He's trying to propose that he will regulate big food, he will regulate big pharma, and he will regulate the policies about toxins, additives, and there is some truth in all three different areas which he is saying. Is it true? Do we have more moral hazards which we are not aware of it? Let's explore. Toxins definitely are adding to chronic medical problems, but we need to look what percentage they are contributing to chronic medical problems. If you believe these toxins and additives are the only reason America is unhealthy and has chronic disease pandemic, we will miss the boat. Processed food. Lot of work can be done on this environment. We have both systemic issues which involves government policy procedures and individual credibility, and then combining everybody together, leading to that. Once we compare United States with the rest of the world, our life expectancy is going down. We do a very good job, and that is where a lot of his criticism lies. In his past, he has been very vocal about being anti-vaccine. It is a proven fact the improvement in length of life or longevity has come from two main reasons. Number one, clean water and housing, and also immunization. And he needs to explain that. Chronic diseases, if you dissect those 10 most common reasons why we suffer and why we die, 72% are only two diseases: cancers and heart attack. We spend disproportionately lot of money in the areas which are not very productive. And during Senate hearing, I saw he has been grilled on that there is a fear that he will probably move money from one agency to this thing. But he is right in defending that the money should go where the problem is, and problem lies in chronic medical problems and chronic diseases. NIH funding is about 50 billion, 50 billion, $50 billion per year. And out of that, top two gets the lion's share of the budget funding for research and development. I think our senators and all other political teams, they are so confused about NIH role in research and development. NIH is not a company or a privately held company which leads to development of drugs, devices, and procedures. NIH provides funding for the basic biomedical sciences so that we could research them, we could understand the pathological processes, and when those graduates go to different areas, possibly with big pharma, they can develop life-saving medications, procedures, and devices. I find they all are lost in this one. But we must be clear what this $15 billion means. I was comparing last night the total yearly budget of country. Pakistan is less than $50 billion, and they are about 30 to 40 million people in that country. So we have one agency just in research and development. We are spending so much of money. Question here is, are we getting the worth out of these fundings? If we have to make America again, research and development needs to go hand in hand, especially when Robert Kennedy confirms that he will make his decision based on the science, and science needs to be funding. Big Pharma will not fund the basic biomedical sciences. Why there has been some concerns in his confirmation, his vaccine controversy, ethical commitments, Medicaid and Medicare. I truly don't believe any of the senators which were asking the questions or he himself had a total understanding of this thing. They have been fed the data that they are programs which are not helping. Absolutely, truth is always in the middle, and we must hash it out for ourselves. America is sick because of some systemic reasons and also our poor lifestyle and life choices. Heart disease, 80% is lifestyle. Obesity, 90% is lifestyle. Smoking, it's a dumb thing to even talk about this thing or ask. Like being a physician, one of the things where I am held as whether I'm developing or giving a standard of care is to document or educate people that they shouldn't be smoking. Physical inactivity and diet. If we have to make America healthy again, we need to understand two parts very, very clearly. We must develop with the policies which will affect systemically from top down, and we must come up with policies bottom up. All of us do not start race of life at the same playing ground. And I saw all the senators, they were acting or believing that we all start life at the same point, which is not a true statement. There are definitely social determinants of health, and there are a lot of other things. We are not dumb. Why we have a poor lifestyle? if we do not care about to dissect out the reasons we make poor lifestyle choices, we will miss the boat. Number one is economic. If money is not there, all processed simple sugars, they are the cheapest source of calories to fill our stomach. Environment. Our environments are toxic. We have not thought enough, we have not planned enough to add parks, exercise facilities, and to nudge people behavior into being healthy. Culturally, social determinants of health, whether you live in inner cities, do you have a transportation problem, the policies do not support. And once you combine economic pressures, environmental factors, cultural influences, social determinants of health, and the policies which are nudging us into alternates which are unhealthy and unsafe, that's what we have the crisis $3.8 trillion elephant. We need individual programs which should assess and educate communities, schools, and individuals about chronic medical problems. If Robert Kennedy gets confirmed, I hope he understands to affect systematically and at the individual level. Systematically, he could have public health awareness top down and pass a lot of information and education. They could have policies to restrict big pharma, big food, additive, toxins, and at an individual level, they need to make healthier food more available. They need to develop policies, planning to nudge public into having a healthy behavior and a healthy treatment. This make America healthy again. It is not a one process. It is a work in progress, both systemically and individually. Systemically, we need to have policies which encourage healthy behavior. And individually, we want definitely liberty to make choices whether we want to vaccinate it or we don't want to vaccinate it. But we do have responsibility socially and individually. So we must have a multifaceted solution which addresses public health, reforms our environment, and promotes prevention. Out of this $3.8 trillion, we spend only 5% in preventive care. This is the only country where system is developed to treat you more, make you more sicker. Your food is making you sick, your healthcare delivery model relishes on you being sick, and nobody's trying to make you healthy. Comprehensive solution to chronic medical disease prevention is comprehensive primary care, which is based on quality, availability, and cost effectiveness. I believe if he gets confirmed and he uses his influence to affect systemic changes, I will say he is the first time somebody who has at least recognized chronic medical problem as a national issue. I wish him luck, and I hope that if he doesn't get confirmed, whosoever gets confirmed keeps his agenda. He must get himself educated and have a deep understanding of healthcare system. And he should not look so superficial the way he looked during hearing. I'm no judge of anybody, but it was not up to the par that the person who is going to lead the second biggest department in the United States didn't have a clear understanding about Medicare and Medicaid, and he relied on rhetoric to push his agenda through. Thank you very much for listening. We have another podcast, Make America Healthy Again. Thank you very much.